This is Dr. Daniel Kelly, and this is a PNI Minute. Today I'm going to talk to you about intracranial meningiomas. These are the most common primary brain tumor, and they can occur all over the head. They typically are attached to the coverings of the brain, the dura, and they can arise in a variety of locations and cause a variety of symptoms, including loss of vision, double vision, headaches, seizures, difficulty swallowing, loss of hearing, and other symptoms. The location determines the optimal treatment, but for virtually all symptomatic meningiomas, the primary treatment is typically surgical removal. And at PNI, we have a long experience in the minimally invasive removal of these tumors using a variety of keyhole approaches. These include the endoscopic endonasal approach through the nostrils, the supraorbital eyebrow approach through a small incision through the eyebrow, an approach called the mini-pterional approach, which is through an incision just behind the hairline, the transorbital approach in some cases, as well as approaches behind the ear and other approaches along the top of the head, depending upon where the tumor occurs. The goal is always maximal, safe removal, and in some instances, because meningiomas may be very adherent to some of the cranial nerves or the brain itself or to critical blood vessels, we sometimes have to leave a small amount of the tumor behind. And we do that to ensure that the patient comes out of surgery better than they went in, with preserved quality of life and not with new neurological problems. Fortunately, most meningiomas are radiosensitive, meaning they can respond well to focused radiation treatment. And so in patients in whom we're not able to get a complete removal, sometimes focused radiation is needed. But overall, the diagnosis of a meningioma, although somewhat scary, is one that can be dealt with very effectively in skilled hands using these keyhole and minimally invasive approaches.